Hello, everyone, and welcome back to the Lube Tube. This is Jeanette and my co-host, Brittany.
Hey guys. Today we're doing a first. We're doing a remote podcast. So we'll see how this goes.
Yes, because life's crazy, and we were going to record one day this week, and I had to leave unexpectedly. And now we're doing this via Zoom. Like, we're just basically getting so good at this recording stuff, I think, right?
Please don't speak too soon, Jeanette. Thank you.
Okay. So anyways, this episode is episode 11, and it's called No Surprises Here, a crash course on contraception. So the goal of this episode today is to talk about pretty much all the options that are available for birth control, and whether that's hormonal versus non-hormonal. And we're going to kind of dive into all those options. And I think it's important that we go over this stuff because there are so many questions. And this is a very common basically visit that I have every day. And I talk to young girls, I talk to older women, I talk to all kinds of women about different options for them and what's going to work best for them. So this is kind of a crash course. You excited?
Soup's excited. Soups.
Soups. First of all, I need to ask you a question.
Uh-oh. What?
How much candy have you eaten since Halloween?
A lot.
I know. Nolan got 12 freaking pounds of candy, and it's just staring at me.
New Bromfuls, settle down. That's
right.
Ridiculous.
That's ridiculous.
What's your favorite candy?
Ooh. Are we talking chocolate?
Well, that's Snickers. I know that.
Yes. But you know what I've been really, really crushing on right now?
What?
Almond Joy.
Ooh, I love me an Almond Joy. Give me the coconut.
Right? So good. Like, it's so good. What about you?
Well, chocolate, I'm going to go Reese's, but I'm more of a sour girly. So give me a sour punch, or what is it? The Nerds. What's the Nerds right now where it's like Nerds clusters?
Nerd clusters. That is Nolan's jam.
They go real hard.
Yep, pretty much. Anyways.
Okay, on topic. So birth control, beyond obviously needing it to prevent pregnancy, what are some reasons someone would need birth control?
Yeah, so a lot of times we use birth control for really heavy periods to kind of control the period so it's not so heavy as far as the bleeding goes. It can also help with painful periods. It can help with things like endometriosis, where the lining of the uterus grows outside the uterus, which can be extremely painful for a lot of women. But we can also use it just if like a girl doesn't want a period at all, right? If she just doesn't want to deal with a monthly period, or maybe just wants to have a period every 3 months. So there's a lot of reasons we can use this. The other things I've given it for is also acne, right? A lot of that hormonal acne that happens to us as women, it can be controlled by specific birth controls that we can prescribe, and that can be really helpful for a lot of girls.
I guess let's jump into the different types of birth control. I mean, that's obviously where most of the questions come from, is which one is right for me, what are the options, and so forth.
Yeah. So if we talk about hormonal options first, right? So the most common one that is prescribed is the pill, right? The birth control pill. And that can be both basically a combination of estrogen and progesterone, or just progesterone alone, right? And so the estrogen progesterone combination pill, that comes in all different doses, all different sizes of estrogen, sizes of progesterone, different types of progesterone. So it really comes down to the patient and the prescriber as to what will possibly work for them and that girl and what we're kind of treating, right? And then there's the progesterone only pills. These are commonly used in women who are 45 and up, who are still ovulating, and we're trying to prevent pregnancy because we don't want to give that oral estrogen like we've talked about before. And then they're also commonly used postpartum when the lady is still breastfeeding but is needing that birth control. Because if we give estrogen to a breastfeeding mother, it can affect her breast milk. So that's why we tend to just stick with the progesterone only types for the breastfeeding mamas out there.
Right. And the issue I have found, and I can speak from personal experience, actually, it's not completely personal. I was on the pill for quite some time, but the personal experience I'm referring to is my mom.
Yeah.
I am the product of missing multiple pills and then thinking it's okay to take 4 at once and it'll do the trick. Not quite, Roxanne.
No,
Not
Roxanne,
quite.
that is not how it works.
I think I've said this before on the podcast, but I was a serious oops. So,
Yes,
but I think that's definitely one of the cons of taking the birth control pill is you got to remember.
Absolutely. Especially when it comes to the progesterone only ones. Those have to be taken pretty much at the same time every day too, where the combination pills, you don't have to worry as much about the same time every day. But yes, every day is very important. And why that is because if you miss a pill, the body thinks, oh, let's ovulate, right? And you spit that egg out and you have sex. And guess what? It gets fertilized and boom, you're pregnant, right? So,
and boom, Brittany.
Then boom, Brittany. So yeah, estrogen, progesterone, those are all obviously super important hormones to us, but they also are used very commonly in the birth control pill. But the other option is a NuvaRing. I don't know if you've ever heard of the NuvaRing. This is what I used in college. I really liked the NuvaRing because I didn't have to remember to take a pill every day. And it's a small little ring. It kind of looks like those rings are those bracelets we used to get when we used to go to Peter Piper Pizza and we would get all those tickets and we would go buy all those little bracelets. Do you remember those?
Absolutely.
And so it's a little bit smaller than that, but you place it inside the vagina and you leave it there for 21 days. You remove it and then you have a period. Me personally, I didn't want a period. So what I would do is I would leave it for 28 days, take it out and then replace the ring. And I took it what we call continuously. And you can honestly do this with any birth control. As long as you're on a birth control, you don't need to have a period, right? So we can suppress a period really much with any type of birth control. It just means basically we taking it continuously. So that's either the patch, the ring, the pill, pretty much any of them that we can prescribe. So I do like the NuvaRing. I like the NuvaRing for young girls. They don't have to remember to take a pill every day. And so they don't end up with that oopsie. But some women are a little uncomfortable about putting something in the vagina, which is understandable because you literally have to place it in there and then pull it out. So go up there and kind of find it with your finger and pull it out, which a lot of women are uncomfortable trying to doing that to themselves. But once you get it down, it can be a really great and effective form of birth control.
Absolutely.
The patch is another option. And the patch is one of the least ones I prescribe just because not a lot of girls want to remember to change a patch every week. And it can leave that sticky film because they're kind of big, actually. The Xulane patch is what it's called. And it is something I prescribe. It's a lot of times my younger girls also that aren't going to remember to take a pill every day. But yeah, that's kind of my go-to if they don't want to do the ring, they don't want to do a pill, but they want something that is going to be something that they don't have to think about doing every single day. But that's a weekly patch.
Yeah. And I feel like that patch is used a lot with our hormone replacement ladies.
Absolutely.
And their biggest complaint is the adhesive.
Yes, the stickiness. Absolutely. And that stickiness, the trick to getting that off is a lot of times some baby oil that can get that off the skin. So that's usually what I tell my patients. It's just a little sidebar.
Wow, what a hack.
Right? Life Hacks by Jane Ash. We're going to add that to the slippery solutions.
Yeah. All right. We also have the Depo injection.
Depo. So Depo is a progesterone only form of birth control. So you could also use this in the postpartum period if you're breastfeeding. And it's an injection that you come into the office and you get every 3 months. The way this works is it actually prevents the ovulation from occurring. And there is a certain amount of time and a window that you have to get that shot. So whenever you go in for your first shot, the nurse will then hand you a little calendar of these certain days that you need to come back for that next injection. And it has to be done during that time. If it's not during that time, then you risk the chance of ovulation, which then puts you at risk for getting pregnant. And so if you're outside that window, a lot of times we do a pregnancy test prior to that injection. The downside of a Depo is recommendation is you should only be on that for 2 years. And the reason why is because it actually lowers your bone density. So I, a lot of times, will prescribe these to young women or young girls just because it's an easy form of birth control. But I always tell them, hey, you got 2 years max on this. And I don't like to prescribe it longer than 2 years. Are there some people that do? Absolutely. But that's just not something that I do for my patients. The other downside is I see a lot of weight gain with the depot shot. That's one of the ones that I see the most weight gain, if not the only one I see significant weight gain with. So I tend to always tell my ladies, hey, if this is the option you want to go with, just know that there is a chance that there's going to be some weight gain associated with this form of birth control. As far as thinking a little bit of like a longer term, there is also another progesterone only option, which is something called the Nexplanon. The Nexplanon is a little plastic rubberish little bar that kind of goes in the arm. And it's done with a procedure that we do in the office, very simple procedure, but it goes in the underneath side of the arm, right underneath the skin. And we do a shot of lidocaine to basically numb that area. And then the Nexplanon device itself has a little tool that actually allows us to place that Nexplanon right underneath the skin. That Nexplanon is good for 3 years, which is nice because it does give 3 years of protection from pregnancy, but it also can send some girls take a period completely away, where other girls, I have abnormal uterine bleeding, right? So that means that they are coming in with spotting or periods 1 to 2 times a month, or maybe not have a period for 3 or 4 months and then start bleeding again. So it has a little bit worse of a bleeding profile than some of the other progesterone only options.
Oh, this is your favorite. Your favorite's about to come up.
Oh, yes. I love a good lark, right? Why do they call them larks, right? A lark is a long-acting reversible contraceptive, also known as an IUD, intrauterine device. This is my favorite, and it's my personal form of birth control. And I've been on a Mirena IUD now. I think I've had this one for 6 years, but I also had one previously too. So we're going to talk about the different IUDs. So you've got progesterone IUDs, which are going to be IUDs that contain a different dose per IUD around the IUD itself of progesterone. And that dose will then tell us how long that IUD is good for. It used to be that Mirenas were good for only 5 years, which is our biggest, longest IUD. But recently they were then changed to a 8-year IUD. So these IUDs are commonly used for ladies who come in that want something that they don't have to think about, that lasts a really long time, that are not so, basically, they don't have as many side effects because they are just localized progesterone. It does have a little bit of a systemic effect, but not as much as the ones that we were just previously discussing. And that IUD, the Mirena itself, can last 8. But if you have somebody that you're treating like really heavy periods with, or maybe really painful periods, then a lot of times the IUD Mirena specifically is good for 5 years. But if we're doing it for just birth control, it can actually last 8, which is really nice. In Europe, they've been using this for 8 years for a long time. We just finally caught up.
I think you're due for yours to be removed, if I remember
Okay, can we not
correctly.
talk about that? Remember, we talked about it.
I just wanted to remind you.
Okay, so it's been there for 6. I haven't really had any bleeding. I honestly have not had a period since I placed it. I'm going to knock on wood, right?
You placed your own IUD?
Well, no,
That would be so much talent.
I would be so talented, but no. Can you imagine? No, I texted one of my OB-GYN friends and I was like, hey, like, what would you do in this situation? Because, for after 5 years, you can take it out and remove it which mine was placed for not only prevention of pregnancy, but also for really heavy, painful periods. And she was like, well, are you bleeding? And I was like, no. And she's like, well, leave it. Like, why go through that pain and change it out if you don't have to? So I'm going to push it to 8 as far as I can and see what happens. Sound good?
Sure.
Do you support that?
I completely support that.
Thank you. Thank you.
That actually like just brings up just a quick thing about IUDs.
Mm-hmm.
In regards to what happens during that process. I know there's been a lot because I'm such a TikTok girly now.
Yeah.
There's been some things on TikTok just about how the procedure sometimes can be a little uncomfortable, and for people to be prepared for that.
I'm not going to lie to these sweet girls. It is uncomfortable. Like I cringe thinking about getting my IUD replaced. And that's honestly why I pushed it out, because it is so uncomfortable. But I think it's important that you talk to your provider about pain control, right? This is important. In our office, we have nitrous oxide or laughing gas available. So that can kind of calm your nerves, but also help a little bit with the pain. I also call in a medication that helps kind of dilate and soften the cervix. So it makes that procedure a little bit easier for me to get that IUD into the uterus. And then I also I pre-medicate with pain medications. So you need to find a provider that is willing to do these things for you so you can have a very, not as obviously not as painful as it can be experienced, a little bit more comfortable. So yeah, I'm glad you brought that up, because this is something that a lot of times women will hesitate getting an IUD for because of the pain, but we can absolutely pre-medicate. And there's a lot of things that we can do to kind of help with the discomfort of that procedure. Going back to IUDs, you've got the Mirena that's 8 years. There's also a Kyleena that's 5 years, which is nice. And then there's also a Skyla. A Skyla is a 3-year IUD. This is the smallest of the IUDs. So I tend to stick with a Skyla only if maybe we only want it for 3 years, right? We're thinking about having a baby in 3 to 4, right? So then maybe a Skyla is better, especially on a girl who's never had a baby, right? If you've never had a baby, your uterus is a lot smaller, your cervix is a lot tighter, and so it's harder to get that device in. So going with a smaller device is a lot of times the route we should take with those ladies. The other option is another one that I personally don't use, but is another brand basically of an IUD, and that's called the Liletta. The Liletta is basically the same IUD as a Mirena. It just has a different device to place the IUD. So it's basically the same thing. But I am a big fan of IUDs because especially in the world we're living in, it's important to have a good, solid birth control, right? And I think it's important to have a plan. And this allows you to not have to worry about a plan.
Have we talked about the copper of it all?
No, the copper. So the copper IUD is a non-hormonal based IUD. And that is literally copper IUD. It's also known as the Paragard. The Paragard is a 10-year IUD. So that's your longest lasting IUD, but it's not going to control your period. So the copper IUD, the way it works is it sits in the uterus just like the other ones do. And it creates a habitat where a fertilized egg is not going to basically attach and create the fetus, right? And so it creates a really inhabitable space. And the downside of a copper IUD is it can cause some pretty heavy, uncomfortable bleeding. So if you're coming to me and you have heavy periods, but you want a good birth control, I'm probably not going to recommend the Paragard, only because it could make those periods worse. Unless you're like, look, I don't want hormones, but I want a good solid birth control. And I'm just like, I don't care about the period. Then sure, it's a great option. But I do have that conversation that it could possibly make things worse.
Copper, since we're on the topic, the copper vanity is super sexy.
Oh.
Have you seen them? And I mean, I have a couple friends that have it, but I've seen it more so in like model homes.
Oh, yes.
Yes, it's so pretty, but apparently it's hard to keep up with.
Oh gosh, yes. We used to have a copper sink in our old house. Well, it was so hard to clean and keep up with. Like, what a pain.
Oh, poor you with a copper sink. Get out of here. Oh my God. First world problems. I'm so sorry. Go sit down, New Braunfels.
You know what? You're so right. I need to back the fuck up. That was awful.
Okay, why don't we talk about barrier methods?
Okay.
How about that? Let's move on.
Yes, barrier method. So this basically is like a condom, right? Absolutely, condoms have been around for a very long time, and they are a great form of birth control, but they are not foolproof, right? So they can break, they can bust. You got to have one, right? And so it's important that also it's the right size for the guy, because a lot of these guys think they're going to buy these big ass Magnum condoms, and let's be real, right? So I think it's important that the girls make sure that the condom actually fits the guy because it can absolutely slip off. So that is a pretty good form of birth control. The other great thing is it also prevents STDs, which is nice. So you're getting two things out of that, where all the other birth controls that I just mentioned previously do not prevent STDs. So the young people that are basically having sex with multiple people, or maybe they have multiple partners, it's important that you protect yourself, but not just the pregnancy, but obviously the STDs as well, right? The other place or the other option is a diaphragm, or even like a cervical cap. This is so weird because I personally, I've actually never had a patient that used one, but obviously they are an option. And they're literally like a little cap that goes over the cervix and blocks the sperm from getting in to the actual uterus or cervix itself. So it's basically, like I said, like a barrier method that just prevents that sperm from getting up there.
Interesting.
There's also a new form of birth control. I say new, it's really been probably about 3 to 4 years. It's a medication that's prescribed called Phexxi. Phexxi is non-hormone, and it's a gel that you insert inside the vagina prior to intercourse. It's not a spermicide, but it creates an environment where the sperm do not live very well and can't don't have mobility and motility. And so that is also something that I prescribe. Not often, but it is something that I've given to my patients. And that's kind of a newer thing to the market. Some women really like that. Obviously, you have to place it in the vagina prior to intercourse, and you want to place it, a good 20 to 30 minutes prior to intercourse. So there's not as much spontaneity when it comes to that.
Yeah, their marketing team was like in full force. Probably like a year ago. I don't know. I just remember seeing tons of commercials about it.
Phexxi is also commonly given to the postpartum moms because it's non-hormone based. It's also a good option for, say, I do place an IUD and I'm telling these girls, hey, you want to hold off and not trust it as a birth control for 3 to 4 weeks. It's a good option for that meantime for them to use that while that IUD starts working. So that's another good option to use it for. Or my ladies who can't do hormones, right? That's another great option for them, or they don't want to do hormones, right?
And we also have the natural
family planning. Yeah, this is very common in certain religions. A lot of times, natural family planning is basically where you track your cycles and you know when you're most fertile. You got to be right on point with this one, though, right? Because like we talked about last time during our menstrual cycle episode, you got to know the signs of ovulation, because if you don't know the signs of your ovulation, you could be having unprotected sex during an ovulation day and then obviously end up getting pregnant. So natural family planning is tracking your cycle. A lot of time it's also tracking your core body temperature and figuring out when that bumps and when that changes is what that means is for your ovulatory cycle. And so it really is more helpful on my ladies who have pretty regular cycles. I really wouldn't recommend this for an irregular cycle girl who's maybe their periods are kind of all over the place. It's probably not the best form of birth control for them.
And then last, but certainly not least, because I feel like it is used a lot, is the emergency contraception.
Yeah, Plan B. It's been around for a very long time, and it also is now over the counter, which is nice. So you don't need a prescription for that. You can actually just go into a pharmacy. Sometimes they have it behind the pharmacy, and you have to ask for it, and then sometimes they have it just right out there. Just depends on where you go. But you should not have to have a prescription for that, which is actually really nice for us girls. But what it is basically it's a progesterone that you take that's going to try to prevent that ovulation. So say you have sex, right? And you ovulated yesterday or the day before, and you have unprotected sex and you're like, oh shit, right? If you've already ovulated, there's a good chance that Plan B is not going to work, right? So it's important that you know your cycle and you know when to use that Plan B. It's also important that you know that your period is probably not going to be its normal cycle after taking Plan B, because now you have kind of interrupted that normal hormonal flux, right? So a lot of women will come to me and they're like, oh, I've just had this abnormal period. Last month I had to take a plan B and I just can't get my period back to normal. It will happen. It's just got to get back on cycle because now you've gone without taking any hormones and then took a big dose of them. And so your body's going to kind of have to get used to that, trying to get it back on its normal cycle.
Being a woman, it's just so difficult.
Right? Like,
you think of everything and then like who tells you this? Nobody tells you this when you take plan B like that. And so how terrifying.
I know.
You're just waiting for your period to come.
Right. Which then it could not come because you took progesterone, I know that's the hard part, right? Like nobody talks about this stuff, right? Which I know is the whole basis of this podcast, but it's so frustrating for girls our age that, I know a girl who took plan B and now she's got a baby. Like you probably do too, and it's not 100% and it's got to be taken at the right time of the cycle.
Yeah.
You already ovulated. I can't promise you that plan B is going to work.
Also, just an aside, I know we've spoken about this previously, but I did not hear you mention the pull-out method as a good form of birth control.
You went off on me last episode about this, okay? It is an option, and a lot of women use it.
I know, but is it foolproof?
No.
So really, we just went through a ton of options, and really the decision that you make is based solely on you and your lifestyle, your history, really what you're looking for.
Yeah, absolutely. The cost, right? Most birth control is pretty affordable. And there are some clinics, and message me on the site if you want to know about these clinics. But say your insurance doesn't cover an IUD, there are clinics that can get it for you really affordable and be able to place it a lot of times same day. So if you have questions about that and you want more information, just message us and I can let you know where to go for that.
I have one more thing to tell you before we jump into myths and misconceptions, by the way.
Mm-hmm.
Do you know what birth control was used in the medieval times?
Chastity belt.
Ready?
Ready.
Magicians in medieval Europe advised women to wear weasel testicles on their thighs.
What?
Or hang an amputated weasel foot around their necks.
What? Where did you get that?
Just what my research led me to.
Weasel testicles. What would that do?
I don't know. It's the magician said that's what you're supposed to do. It wasn't a doctor. It was a magician.
Yes. Oh my God. I have never.
I know
that.
Weasels. Who would have known?
Who would have known? Who would have known? Those damn magicians.
To the myths and misconceptions of our time.
Yes.
Okay. Myths number 1. Birth control causes infertility.
No, it doesn't. Everybody is worried about this, especially my young girls. I had a girl today, actually. She was 17 and she came and saw me and she was concerned that if she stayed on the birth control, would she be able to have babies one day? And my answer was absolutely. Absolutely. And if you're not planning to have a baby right now, then we should stay on the birth control, right? Because a lot of times women think that if they're on a birth control, it's going to prevent pregnancy or future pregnancies later on when they do get off of it. And that is not true. That is a common misconception.
What about all birth control methods make you gain weight?
That's not true either. I want to say it's like a certain birth controls. There's usually a 3 to 4 pound average weight gain with just depending on which birth control. I will say, like I said earlier, the Depo, I do see weight gain with that. And I will say that I do see weight gain with the Nexplanon. So those are the two that I always tell my ladies that there's a good chance you might have weight gain with these two forms of birth control. So we really kind of talk about that and I educate them on that before they make that decision for themselves.
And lastly, you don't need birth control if you're tracking your cycle.
Like we talked about earlier, the natural family planning, right? You got to make sure you're tracking it right? If you are truly tracking it correctly and you know when you ovulate and y'all are not having unprotected sex during that time, then yes, I think it can work. Especially, there's a lot of women that just know their body and that works for them. But Personally, I never could do that.
Yeah. And I think it's another thing to bring up is that you may not get it right the first time. You may do a birth control and it doesn't work for you, or you don't like the side effects.
Uh-huh.
So moving on to another one that's totally okay. And honestly, huh?
I agree, right? I have so many times we change it up because the first thing we tried doesn't work, right? So yeah. And that's why a lot of times, like, say you come to see me and I start you on something new, I'm usually going to follow back up with you in about 3 months and just see how you're doing on it. See if it's controlling the cycle like we'd hoped. How are your periods on it? Are you getting a period on it? How are your moods, right? Have you noticed any mood changes? Because that can sometimes happen too with some of these birth controls. Are you getting any migraines, right? Oh, that's another thing that we should talk about. Somebody with migraines, right? History of migraines with an aura, right? So that means that right before that headache is coming on, you like maybe see something or smell something weird or have like a little fuzzy vision change. That's an aura. And that usually tells you, hey, I'm about to get a migraine. Those girls should not take a contraceptive that contains estrogen. So, I mean, like an oral birth control, right? Those girls should be more on a progesterone only form or an IUD or some different type rather than a combination contraceptive because it increases their risk of stroke.
Ooh, we don't want that.
No, 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 no.
So I know this can sometimes be a hard conversation for younger girls to have with their moms, or maybe they just don't feel comfortable having this conversation with anybody. So, do you have any advice on how to?
You know, it's so funny that we're talking about this because do you remember that 17-year-old girl I was just talking about? She actually picked up her phone and she called her mom like during the appointment. And her mom was so great. Like the way she talked to her, I was so impressed. The daughter said, hey, mom, I'm thinking about taking a little break from my birth control. And I kind of wanted to see what you thought about it. And the mom was like, well, you're in a pretty serious relationship now. And I know y'all are not having sex right now, but you don't know what's going to happen. And you don't know if y'all are going to become more serious and maybe become sexually active. And I know you, and I know you have big goals, and I know you would want to protect yourself if something was to come up like that. And also, the whole point of you getting on this birth control is because you were having some really bad PMS symptoms. And I have noticed a huge difference with that. And I was like, wow, how great, right? Like, how freaking great did she do that? And so, just being open as the daughter, being open with your mom saying, hey, I really just want to protect myself, or I really need help with these periods. And as the mom being like, okay, yeah, I'm here to help. How can I help you? So I thought that was great.
That's very sweet. We
You
love to
know,
see that. It's always nice to see a daughter who is having that open dialogue with their moms
right.
because it seems like I don't know, maybe this is just a generalization, but I feel like at times there is less communication now because there's social media and there's other ways to communicate with other people other than your parents.
Yeah. And other than just talking, right?
Yeah,
Absolutely.
preach. Did that make you sad?
No, it just made me think about like how great their relationship was, right?
Yeah.
I have boys, but if I had a daughter, that's how I would want to be. And I obviously didn't say this to the mom. I wanted to say, hey, mom, like, thanks for being that person for her. Like, she immediately was like, let me call my mom because I know she'll help me through this. Because we
Right.
talked about options for her. And she was like, hey, let me just call my mom real quick. And I was like, oh, yeah, let's call her.
Yeah.
I thought it was great.
I love that.
Yes. Okay.
So, in regards to birth control, we know it is never 100%.
Mm,
It's not going to protect against all pregnancies or STIs, STDs.
right.
And it's used for many different
Right.
scenarios, not just let me not get pregnant.
Absolutely. And you got to take it right. Like if you're taking the pill, you got to take it every day. Right. And if you want to skip a period, totally safe. Say you're going on a trip and y'all leave and you're supposed to start your period that week. Well, just skip the placebo pill and start the new pill pack, and you could actually skip your period, right? So there's a lot of great things you can do with these pills too. You don't have to have a period, which is awesome. And you also can have a period every 3 months. It just kind of depends on how and what your provider kind of recommends for you.
I think it's that time.
Oh, slippery slope.
Solution. It's so much harder when we're not together. Oh, wow. I thought you were done. That's how bad it was.
I'm going.
Okay. All right. I've been with my significant other for some time now, and we want to spice things up.
Ooh.
We were thinking about adding a third in the bedroom.
Oh, really? What would that be?
What are things we can discuss prior to adding this person?
Oh, wow. This is a really big decision, right? Like, we need to talk about, first of all, is it a female-female relationship? Is it a female-male relationship? And if it's a female-female, are we adding a male or are we adding another female? Is it a female-male and we're adding a male? Is it a female-male and we're adding a female? Like, oh my gosh, there's so many different sides to this story, right? Protection, right? Like going back, like we need to make sure everybody involved is clean, right? No STDs, because that's how things happen, right? That's how people get STDs and then they start to have a lot of resentment and then they're stuck dealing with that. And then also going back to birth control, is everybody in this situation protecting themselves, right? That's also very important. And then making sure that there is no jealousy involved, right? Because in some ways, this can be really helpful for a relationship for some couples, but in a lot of other relationships, this can create a very big jealousy issue, right? So you need to make sure that everybody involved is ready for that huge step.
Yikes.
Yikes.
And it could never be me, but I know people that it's worked well for. I mean, personally, I think that I want my person and I don't want anybody else to have a part of that. But that's totally a personal thing. And like Jeanette said, it does do good things for some people.
Yeah. I mean, there are some, and I have friends, right? But there are some people that, that's just common for them. And that's great. If it helps them and they're comfortable and they're safe and they're happy, then whatever floats your boat. But just have to make sure that everybody's consenting, everybody's on the same page, and everybody is clean, right?
Yeah. Well, and also there is a chance that your partner could fall in love with the other person and be like, peace.
Oh God,
I've seen it.
Yeah.
So yeah.
That's okay. Yes.
Okay. Well, I think that was good. I think that was it.
You're it? We're good? We answered them all.
Yeah. What?
We answered all the questions.
I feel like we did. I sure hope so.
We talked about all the topics.
I wonder if this is going to sound right. Can't wait.
Probably not.
But we tried, y'all. We tried.
I'm actually missing the most.
What?
So normally, guys, we record at Brittany's uncle's house early in the morning. A lot of times we do this very early in the morning. And he always has my coffee cup and Brittany's coffee cup ready. And he's the kindest, sweetest person. And then on top of that, he sends me out the door with a freaking snack. He's so kind. He sends me home with snacks.
You a snack, girl. You a snack.
Oh my God. Anyways, I just miss those mornings because I really enjoy them. But since my schedule changed, we don't get to record in the mornings. So now we do afternoons. And now obviously this week didn't work. So we did this Zoom thing. So hopefully this works. I'm excited about this if it works, because it obviously gives us another option. But at the same time, I really like being face to face when we record.
Right.
Okay.
Well, thank you.
Yeah. Thank you. I hope that everybody learned something about birth control.
And we look forward to talking to y'all like real soon.
Yeah, like really soon.
Oh, by the way, we're going to Round Top this weekend. Yes. So maybe we'll have some fun stories.
I can't wait. I'm so excited. We're going with a bunch of girlfriends and it's going to be so much fun.
Maybe we'll talk about contraception.
Yeah, I'm sure. I'm sure the word vagina will come up this weekend.
One time or another. All right, y'all. Have a good week. Bye.
Bye.
The information provided in this podcast is for general informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.